Okay, so here's the agenda for today. We're going to talk about addressing state priorities through permanent supportive housing. We're going to speak generally about components of successful partnerships between owners, property managers, and support service providers. And then we're going to tee up this discussion about a funding opportunity from our agency that's coming up. And before we get into that funding opportunity, I want to say I imagine many of you are interested in applying for this funding are going to have a lot of questions about that. You're going to want a lot more specific information. And so because this will be a request for proposals issued by our procurement office, there will be plenty of that information available when the funding opportunity is posted. So there'll be a full description of what we're looking for in applications, all of the details about when things are due and what the proposal has to include, the timeline, all of that, likely a pre-proposal conference where you can ask some questions about these kinds of things. And then those questions and responses can be shared with everyone who might be applying for the funding. So today is really just to talk about this partnership around the tax credit units and start to get service providers prepared to engage with these property owners so that we can deliver services to the populations that we're talking about. There was a companion webinar earlier this week for these property owners. So those folks have, if they join that webinar, an awareness that we are providing this funding opportunity and that we want to help connect service providers and property owners, but we will need to continue to engage the owners and property managers themselves. So these are the whys. Why are we doing all of this work? So as a state agency, we look to direction from the administration, the General Assembly, and other drivers of our priorities. So right now we're working from Governor Northam's Executive Order 25, which identified 3 main housing goals. And those were increasing the availability of affordable housing generally, increasing permanent supportive housing available for vulnerable populations, and preventing evictions. Additionally, you know that the Commonwealth is under a settlement agreement with the Federal Department of Justice, which obligates the Commonwealth to ensure that people with developmental disabilities have access to a full range of supports and services to help them live full lives integrated into the community. We also have worked with the Commission to Study Mental Health Services in the 21st Century. That's its formal name. You may know this legislative reform body as SJ 47 or the Deeds Commission. And that group had a housing work group that at one point charged the Department of Housing and Community Development to lead a stakeholder group to identify and develop strategies to increase housing opportunities for individuals with serious mental illness. So those are some of the reasons that we're focusing on the populations we're going to talk about today and on the particular strategy of permanent supportive housing to address those needs. And you're looking at who are the state agencies who do this work and how are they organized. So there are 8 state agencies that work on an interagency leadership team for housing and support services. You see them listed there. Each of the executives of those agencies sit on this interagency leadership team that decides these kind of directions, that charges what we call a permanent supportive housing steering committee, comprised of sort of management level folks from those same state agencies. The ILT asks us to implement plans to address the housing and support needs of particular populations. Those groups also have 3 stakeholder groups that advise our work. You may be familiar with the Governor's Coordinating Council on Homelessness, which looks broadly at preventing and ending homelessness in Virginia across populations and a range of strategies. But particularly for people experiencing chronic homelessness, we know that there's a great need for permanent supportive housing. We also have a stakeholder group advising the Virginia plan to increase independent living options for the DD population, and a housing strategy stakeholder group advising the work of housing and folks with serious mental illness. And you can see there's significant overlap in the work of the Governor's Coordinating Council and the SMI work in particular. So how does PSH help address those state priorities? Well, we know as a starting point that we're trying to address some high-profile issues for the individuals in these populations. So, for example, we're in a settlement agreement that's requiring the Commonwealth to improve access to community resources for individuals with developmental disabilities. Right now, in spite of all of the work that's been done and the significant progress that's been made, we're still behind the curve nationally. So nationally, about 18% of individuals with developmental disabilities live in independent housing. In Virginia, we're just under 10% of that population. So we've got work to do there, and PSH is a solution. You've likely heard of the crisis in our state psychiatric hospitals, where there's insufficient bed capacity and staffing to support individuals who need treatment at that level. At any given time, we've identified about 200 individuals who are clinically ready to leave the hospital. Their treatment issues don't need to be met in a hospital setting, but they cannot leave the hospital because of a lack of community resources. The most commonly cited is a lack of appropriate housing and supportive services. Additionally, we now can identify that the single largest subpopulation of people experiencing homelessness in Virginia is adults with serious mental illness. And across all of these issues, we know that there's a significant body of published research that tells us permanent supportive housing is an effective solution. So I mentioned the housing action plans that these state agencies have developed and are implementing. If you're familiar with permanent supportive housing, the building blocks of that model, you have to have capital to create the housing units. You have to have a source of operating funding. Often that's rental assistance that covers the difference between what someone can afford to pay with extremely low income and the actual rent on the apartment unit. And then there are the supportive services. So you see the range of sources that the state looks at when we consider how to implement these action plans. All of these state resources are at the table and being used in a variety of different ways, only one of which is this partnership around the low-income housing tax credit units. I want to note here the services component. The broad buckets of services are existing Medicaid services, and you see some listed there. New Medicaid services that we're anticipating in the coming months or years. Non-Medicaid services, and you see some of the state agency resources that pay for services that are not Medicaid are listed there, and of course, private funding. So as we talk about these partnerships, how do you fund services is a huge question, a huge challenge. It's part of the reason that we're going to talk about this funding opportunity. But I do want to say that these housing service partnerships are essential, whether or not they're funded by this particular source. So there are many providers who've been out there doing this work for years, and they use a range of these sources to be able to fund the services in supportive housing. I know we have some folks on the line who aren't housers. The Low-Income Housing Tax Credit Program, abbreviated LIHTC, may be new to you. So just a basic grounding. This is a federal program administered by the IRS, which essentially incentivizes private investors to invest in tax credits that produce the units themselves And by doing so, those private investors lower the amount of their federal tax obligation. So investors like big banks look to purchase low-income housing tax credits to lower their tax obligation. And the benefit of that is the actual production of affordable rental units. And across the country, the LIHTC program is the largest driver of affordable housing development. In Virginia, the LIHTC program is administered by Virginia Housing. You may be familiar with them by their old name, formerly the Virginia Housing Development Authority. So they have partnered with the other state agencies and have committed that 10% of the units produced through that program are committed to address these state priorities. That should produce about 200 units a year that are just these preference units that we're talking about. A preference is essentially prioritization. So rather than having to come through the same door as other community applicants for that apartment building, preference units have a prioritization for folks identified in these state priority populations. Developments themselves are very complex and have many layers of financing. That becomes important when you talk about how property management works and how services work. And it's important to understand too that the development timeline, so from the point that a housing development is awarded an allocation of tax credits to when the property leases up is approximately 2 years. So we're not talking about quick turnaround here, but it does permit the time to build out the kind of partnerships we're talking about today.
Kristen, can you hear me? This is Doug Bilski.
Hey, Doug.
Hey, I'm so sorry to interrupt. We've got a couple folks who messaged me that they were waiting, that would like to join us, but are waiting in the lobby to be admitted.
Okay.
Thank you. I'm so sorry to interrupt.
That's okay. I think we got them. We can give them the recording too. Jeannie, let me know if you need anything from me. I should have mentioned we have
we've got everybody covered here.
Okay, good, thanks. So I just want to recognize Jeannie Cummins is here from our office and Monica Spradlin. So Jeannie is helping drive the technology today. Thank you.
Thanks so much.
Sure. All right, so how has this partnership evolved? Virginia Housing has been committing preference units for a number of years now to help address state priorities. Originally, those preferences were for individuals with a developmental disability. Beginning in 2019, the requirement was changed so that 10% of all units produced through the LIHTC program have a preference for these state priority populations. So a very generous commitment for sure. We'll talk a little bit more about that as we go along. The use of these preference units is referenced in those state action plans that I discussed, along with quite a number of other strategies to increase PSH. And so we work collaboratively with Virginia Housing to implement the use of these preference units. We develop policies and procedures to guide our own work. Virginia Housing works on educating owners and property managers. We work on educating service providers, coordinating with service providers at the community level, and providing the oversight, training, and technical assistance for all of those partners. So part of the messaging when you engage owners involves the impact of permanent supportive housing. So permanent supportive housing not only gets folks off the streets and out of that cycle of using criminal justice systems, hospitals, or being in group homes or institutional care, but it helps reduce the use of those systems so that people do not return to homelessness. They do not continue to revolve through those settings. And it's because of the housing paired with the services that programs are able to get those outcomes. So, you know, housers aren't used to targeting the most vulnerable necessarily. And that's what we're doing here. But our messaging is when we have the housing and the services, it's really the solution to making sure that we reduce homelessness in our communities and that people aren't using crisis levels of care anymore. And that's validated by decades of research. And again, we know that those strong partnerships are essential to that. Some conventional affordable housing properties have some level of services. They may not look like permanent supportive housing services though. So that's one thing as a PSH service provider would be to be able to understand and articulate the difference. So this isn't just like a volunteer program or a resident services program that might be light touch, offering general resources for tenants in a property. This is really specialized services provided at the level that folks need to support their disability-related needs. Sometimes these services are called tenancy support services. Support services is a very broad term. When we're talking about the services in permanent supportive housing, we're really talking about these housing-focused or tenancy support services. And some of those are listed here. So the tenancy support services would include outreach and engagement. So helping people apply for the housing, get through the process of completing all of the documentation, getting the resources they need to move in, and engaging with folks throughout the course of their tenancy. So if people live in an apartment unit for years, they may go for some stretch of time where they aren't actively engaging in services. But if things start not going well, then a service provider in PSH would want to reach out and reconnect with someone and re-enroll them in services. Again, the primary focus is helping folks secure and maintain housing. So the support service provider would be assisting to make sure people pay their rent, make sure that they understand the terms of the lease, that any issues that might cause a lease violation are addressed, make sure that people maintain their units in good condition, preventing and managing crises that may happen for individuals, helping people secure and maintain income, and when people might be interested or able to move on to another setting, supporting them in finding other housing and moving on. All of this work is very individualized. Many of you are familiar with that kind of individualized work, so there's not a one-size-fits-all approach. You'd be building individual plans with people who are in supportive housing to help them achieve their goals. You would want to be connecting people to community-based services. So people that we're prioritizing here need much more than tenancy supports generally. So they may need treatment, clinical services, habilitative services, rehabilitative services, recovery support services, which are all provided by providers in the community. So the permanent supportive housing service provider would want to make sure that people are aware of and connected to those services. All of these services are voluntary, and that there's ongoing communication with those providers to make sure they understand anything that's coming up in housing that might impact their treatment services. Community building is really fostering that sense of community within a building. So community events or guest speakers or on-site groups or resources might be organized by the PSH service provider. And of course, there has to be administration and oversight of those services by folks who are qualified to do that work. Here you see some of the functions kind of broken out by whether it's a property management function or a supportive services function. Some of those things are pretty distinct and clear. So lease enforcement, lease violation notices are coming from property management. They are not coming from the support service provider. When there are maintenance units and issues in the property or in a unit, that's a property management responsibility. Conversely, the supportive service provider is working directly with those individuals to help them build the skills they need to live independently and achieve their own personal goals. You can see some similarities. Each of them is responsible for regulatory compliance. So however the property management entity and the property are funded, or the support service provider is funded, they've got their own responsibilities to make sure that they're fulfilling those requirements. But in the center are these shared goals, right? So both teams are looking to promote housing stability. Stable long-term tenants are a great thing in the building. And the property management and the support service provider are just working in different ways to achieve that. Fostering a healthy sense of community is, again, a shared goal. Preventing and addressing crises, again, those two teams would come at it from a different way. But when there's a hurricane, a tornado, other non-weather related emergencies, the support service provider and the property management entity would be working together on a plan, and they would have different responsibilities for the property versus the support needs of the individual. Here's another way of looking at roles in the day-to-day obligations, just a different way of looking at the functions that each entity performs. So they may both be assisting people with applying to the property and getting through the process, but they're going to do that in different ways. Okay. Let's talk a little bit about this services funding opportunity. So our agency is going to issue a request for proposals this fall to identify multiple service providers for multi-year funding commitments. Providers will need to be experienced service providers. I've mentioned the populations that we're looking at. So folks with developmental disabilities, folks with serious mental illness. There'll be a state-defined process to identify those individuals and help them access the unit. I just totally lost my train of thought. But whoever moves into the property is the population that the support service provider will need to serve. So likely a mix of individuals with developmental disabilities and individuals with serious mental illness. So that's the kind of service background that we're asking for. Those service providers have to be licensed to do business in Virginia, do not have to be licensed by our agency, but such a license would be evidence of service experience, and you need to be registered in the state's procurement system in order to apply. Our office's role is to select grantees. We will provide the funding. We're going to be providing training and technical assistance, as well as managing client level data that's going to tell us about the effectiveness of these services. This funding is specific to this LIHTC initiative. So we will talk about how to identify where those properties are and who the point of contact is at each of them. But this is not an opportunity for any affordable housing provider paired with any service provider, or even a tax credit property that's been around for years and may not have these preference requirements. So we're really focusing on the LIHTC properties funded in certain years with these preference units, and we want to pair that with the services that we're talking about here. In order to apply, the service provider agency has to have an executed memorandum of understanding, essentially a contract with the property owner. And we'll talk a little bit about what has to be in that in a second. Owners, like I said, have already been through a webinar, so they may be reaching out to identify service providers. Some of them may already have partners that they've worked with for years, but many of them do not. Many of them do not have these connections and will be seeking an interested service provider. We really want to be targeting those properties that are going to be leasing up in the next year. And when we talk about some of the complications, I think that will make more sense. We do anticipate that there will be future rounds of this funding. So if you go through the process of seeing where are these properties going to be, where does my agency provide services, and you see that 2 years out, one of these properties is coming to your community. It's not the time now to apply. So we want properties that are going to be leasing up no later than 2022. I listed here the commodity codes. Basically, if you're registered in EVA, there's a way to tell that system what kind of funding opportunities you're interested in. So if you are registered under any of these codes you see here, it will automatically send you a notice that the RFP has been posted. Okay, so here's where it starts to get complicated, if it doesn't sound complicated already. So Virginia Housing's commitment of 10% of the units that come through the tax credit program is incredibly generous. There are times, though, when some properties are not a good fit for the folks that the state is prioritizing. And it can be as simple as a mismatch between what size apartment the applicant will tend to need and what size units that property has. So if we tend to see, and we do, individuals who are living by themselves and need a studio or 1-bedroom apartment, but the property has 2- and 3-bedroom units, then it can make that difficult to line up. So I mentioned that we know which properties are eligible properties. We're going to give you that list, and I'll tell you how to get that. So, that narrows down where we're able to focus. So if you are exploring whether you're interested in providing these services through a partnership, you will be able to see which properties in which community are coming online in the time period that we're talking about. The owner has to be an active participant in the funding application for services, right? This is a partnership, and we want to make sure that where we fund the services, we are also likely to have our applicants make use of the rental units. So we want to avoid that misalignment I talked about, with the bedroom size being one example. But also it's important in sitting down with an owner to talk about mission and vision. Is that something that you share? Can you find alignment like I showed with that Venn diagram? Where do those roles overlap? And do you share a common understanding that you would work to collectively support those goals? You want to be able to ask that owner their timeline for lease up. They're going to have the best information about the construction timeline, better than information that I can give you, so that we can make sure that those units are coming up in the next year. You want to know how many preference units are in the property that you're talking about. So talk about scale in a minute, but that's part of the challenge here, is that you may have an 80-unit property, 10% of that is just 8 units. So you would be bringing services to the table for people in those 8 units. You want to talk about the geographic footprint. So what area does the developer serve? Does the property management company serve? What area does your agency cover to deliver services? So some of you may have a very specific locality, and some may serve a region. You may be willing to expand more broadly. Those are all conversations you need to have as you explore a partnership with the owner. You want to talk a little bit about property management and how it's done for that owner. Many folks contract out property management services. So that's a different company at the table sometimes that you want to make sure you're having these same conversations with. And then what kind of resource commitments can the developer or the owner bring to the table to support the work of the service provider? Is there office space on site for a service provider where they can meet privately with tenants? Do they have IT infrastructure so that if you have an electronic health record, they're able to log on and access it there? And is there community space for that kind of community building activity that I described earlier? And these are some more kind of complexity, special considerations that you want to ask about. Again, what we really want to make sure is that we're funding services in properties where we're likely to be able to take advantage of those units, where the folks we want to prioritize are going to be able to move into those preference units. So a very simple, straightforward one is what I already talked about. So unit size and rents. Rents, because sometimes folks come with rental assistance. Most often they'll have to in order to afford the unit. And you need to make sure that the rents that they're charging would fit in what the subsidy source is able to pay. Again, scale. We are interested in service providers who are able to serve more than one property, even if those properties have different owners. So we're calling that the hub model, and that's a term in the field, not just our term. But essentially, if a service provider were to approach multiple properties and together across them, there were enough people to serve to justify more robust services, that would obviously be maximizing the use of the resources and the services. You want to take a look at the tenant selection plan. So the property has rules that explain access to the property and who is eligible, where there are priorities or preferences, where there are exclusionary criteria, and the composition of those tenant selection plans is up to the owner. So sometimes the bar is set higher than the folks that we want to apply can get over. So for example, exclusionary criteria for criminal background. That's common. You would see that in any tenant selection plan. But if the bar is set too high, then that means that we would not be able to take advantage of that unit because the folks that we want to prioritize may come with that kind of issue in their background. There are a couple of resources bulleted out here. So if you look at the HUD Office of General Counsel guidance on use of criminal records by housing providers, that describes this issue, which is essentially because people of color in particular have been over-policed, been subject to involvement in the criminal justice system disproportionately. That means that these background criteria can often, even if not intended, result in disproportionate impact. So it's a fair housing issue. It's very complex. It's something that these owners are being asked to take a look at, but that's something that we want our service providers to also be very aware of. Referenced here is the Virginia Office of the Attorney General's model tenant screening protocol. That can be a valuable resource for owners to let them know what best practice standards are for those tenant selection plans. And for example, one tool that's often used is an individualized review of the applicant. So if an issue comes up in someone's background, rather than just throwing the application in the rejected bin, there'd be an opportunity for the individual circumstances for that person to be considered. I mentioned earlier that rent subsidy is critical. These units are not affordable to folks with extremely low income if they don't also typically have a source for rental assistance. I've identified some of the sources here. Some properties already have those resources committed. Very often they will come through our agency as part of the process to identify potential applicants. Other things to consider, the property may have many other commitments other than just the commitment for these preference units. So if they have said that this is designated as an elderly only property, that would mean that the folks in the preference units would also have to meet that age requirement. Sometimes that works out well. Sometimes it means that it's one of those units that we probably won't be able to make good access to. Another issue is to look at the concentration of tenants with disabilities in the property. Again, some properties make many commitments to community partners, and some properties are specifically developed so that the entire property is to serve as supportive housing. And that's a very valuable model. Here, though, we have to be careful that we don't over-concentrate people with disabilities, and in particular, our resources aren't invested where the concentration of people with disabilities would be more than 25%. So no more than a quarter of the units should be designated for individuals with disabilities. I think that this is a higher level of complexity, but for properties that were developed earlier, when the preference unit commitment was just folks with developmental disabilities, if that property is interested in broadening that preference so that we might also refer folks with SMI, that's something that we can discuss, and that would give us additional units to take advantage of. And I mentioned before, the owner may have other resources that help to support an effective services program, and that would be something you would want to ask about. Okay, I mentioned that an executed memorandum of understanding between the service provider agency and the owner entity is required to apply for our services funding. What has to be in that MOU? Very broadly, an agreement about the purpose of the partnership and a commitment to those shared goals and outcomes. And then
Kristen, I think we may have lost your volume.
what's that?
You're back. I was going to say, I think we lost your volume, your microphone, but I think you're back.
Okay, yeah, I've had technology issues all day, so I wouldn't be surprised. So if you made it this far, you're interested in the funding opportunity, the next step is to reach out and engage one of these property owners. They've already been offered this webinar. If you happen to reach out to an owner and they weren't able to participate, Virginia Housing recorded their webinar for the purpose of sharing with folks who missed that session. We also have that list, which properties, which localities, what's the contact information that we would love to share with you. To get that or a copy of the slides or anything else, you see this LIHTC email at DBHTS. Feel free to send an email to us and we'll get you those resources and help you connect with some of these entities. Now, once the RFP is posted, we will not be able to assist, right? So there's an active competition for public funds. That means that we need to not assist one potential applicant more than another. So we won't be able to provide that kind of assistance while the RFP is posted. But before then, we're happy to help. Virginia Housing is able to help as well. And then you want to hold meetings with these owners. So you want them to meet your team. You want them to hear about your experience, your background, your staff, and again, how you can work together to achieve these shared goals. And at the same time, you want to be able to ask those questions about the property, the staff, the property management, so you can start a strong foundation for working together. Okay. That was a lot of talking. We have what looks like to me 47 folks here, which is very manageable. So before we jump into letting you all ask questions directly, Jeannie or Monica, were there questions from the chat that I can't?
There are.
Yeah, there are a couple.
Yep. Go ahead, Monica.
Yeah, the first one, is there an opportunity to project-based PSH or SRAP vouchers?
Wow, advanced level question. So there already is a mechanism. Essentially, that means there's published guidance about project basing SRAP, or state rental assistance for folks with developmental disabilities. That guidance does not exist yet for our PSH funding for folks with serious mental illness. So if that's something that you're interested in, we would like to do more of that. I would say don't use that LIHTC email address. Feel free to email me directly. But we're working toward being able to project base all of that.
Okay, and then another question was, for the upcoming RFP, you referenced it targeting those units with a lease update of 2022. And did you mean calendar year or fiscal year 22?
Yeah, so I meant calendar year 2022. And, you know, what we're able to do, who we're able to fund with this round really depends on what kind of applications come in. And what I would say is, if you are thinking of working with a property where the timing is unclear, or it might be on the outer edge of that, if you apply and the timing doesn't work, but next year's funding cycle does, then you've already got a developed proposal that could be tweaked with any modifications we make. So, you know, it's a little bit hard to be cut and dry about what the outside cutoff is, but that's what I would say right now.
Okay, and thus far, those are the only questions in chat.
Okay. Who else has questions?
This is Sarah from Arlington. I'm just following up on I was the one that asked a question about the calendar year versus the fiscal year. So is that, they have to be completely leased up by the end of 2022?
I would assume like pre-leasing would have begun by the end of
Pre-leasing, okay.
2022.
Okay.
Mm-hmm.
And can we use this for projects where we would kind of get the units on turnover? Or does it have to be a new project?
It does not have to be a new project. So yes, you could apply for units that would be accessed at turnover. It makes a more compelling application if there's like an expansion of opportunity. So if those are units that we already refer to, have access to, pay for services, then it wouldn't be ineligible, but it might be less competitive in terms of impacting state goals.
Okay, so we had another question. Can new providers participate in this project?
Yeah, so when the RFP comes out, you'll see exactly what the requirements are. we do want experienced service providers, but that does not mean you have to be experienced providing the tenancy supports. So that experience could be, you know, history of delivering services through other mechanisms or to other populations. Now, if you are a new service provider and had never done any of that, you know, you would have to make the case that you're an experienced service provider. And I'm not sure what that would look like if the business entity had never done this work before.
Okay, another question is, can the provider own the property or apartment complex?
Yeah, again, in the RFP, you'll see, so that's not an uncommon model where the owner developer also provides property management and services even. But we want to see how internally you make sure that housing and services are separated through governance, operations, policy, and that's you know, going to be well understood by folks who do this work. But essentially, like, you don't send case managers up to collect people's rent checks. But throughout the roles, you would want to make sure that even though the same agency operates them, you can keep them distinct, which is the best practice approach.
And does this RFP only cover supportive services?
Yes, but I'm not sure what the question, like what other things are there questions about? In other words,
Would it cover rental assistance?
no.
No. Okay.
And the RFP will explicitly say that this is not funding for rental assistance.
Okay.
So we're working to patch that together, as you know, from other sources. So no rental assistance RFP.
And so another question is, can the tenancy be with a roommate?
Yeah. So the value is that people identify their own households. So they live with who they choose to live with, but programs do not match people together to take advantage of a resource. So if we were to identify folks who were friends and wanted to live together as roommates or any other kind of arrangement like that, that is possible, but we don't require people to live in a household configuration that we decide for them.
No, I think that is it.
All right.
And yes, we will send you contact information. And the email again is listed in the PowerPoint to request.
Well, let me clarify. I don't have we didn't have a registration for this session. So I don't believe we have your emails unless, did we find it through the screen?
No, but I can grab this person's name.
Okay, so let me just say the short answer is we don't have your contact information. You will have to email that LIHTC@dbhcs.virginia.gov email in order to get any of this information. And then when the RFP is posted, that's public information. You can go straight to the EVA website, look for it there, should be posted by October. All right, everybody. Appreciate your time. Have a good afternoon.
Thanks, Kristen.